Kyle's really one of the unsung heroes of the overdose crisis. The overdose crisis is pretty horrendous, and we're losing a lot of people, and Kyle goes above and beyond to support people who use drugs.
If a patient had overdose, he had to help and basically administer naloxone.
I had relapsed, and I'd OD'd in my car, and he found me and hauled me out and Narcaned me, and brought me back to life. So I owe him a lot more than just my money. Yeah, it was pretty crazy. I didn't even know he was there until I woke up and he dragged me inside.
Basically, the issue is there's a lot of cracks in the system. A lot of people are not able to get access to the care that they need unless people who care actually go to them.
We have group home patients, we have mental health patients, we have OAT patients, so we have regular retail patients. So it's a regular day at the pharmacy, we're all working. All of a sudden, a gentleman, a relatively young gentleman, walks with his underwear, sat on the chair right there. I just look at Kyle and I'm like, okay, one of our new patients? And he looks at me with the eyes like, no, we're just talking eye to eye, we're not saying any word. And then Kyle approaches the gentleman asking him if he's here for medication, if he needs anything else, if he needs any over-the-counter product, if we need to do any sort of assessment on him. He was just so kind, like, even though he wasn't our patient, he just happened to walk in.
He's got a very calm, loving demeanor.
He's an advocate for them. He makes sure he gets the best possible care.
He's definitely the best pharmacist I've ever had to deal with. Like he's never been late. He's never like said, "Oh, sorry, AJ, I can't get that done for you." He's definitely the most fastidious, helpful pharmacist I've ever had to deal with.
So yes, my job involves going into the woods, looking around trees and bushes, trying to find my patients, hopping over fences. It's not what I learned in school, but it's definitely an amazing part of my daily experience. It's just a service that is so needed at this time, especially with the multiple health crises going on. We just need to go the extra mile to find our patients and make sure that they get the care they need, even if they are hard to locate. So I've had an encounter where apparently some neighbors thought I was up to some nefarious activity, and I was swarmed by the cops while attempting to assist one of my patients.
You don't meet many pharmacists like him.
So I've always tried to go the extra mile for customer service or patient care. It's just something that I've always wanted to make sure that the client or the patient leaves feeling that their needs have either been fully met or at least fully acknowledged.
He should get the reward for the best guy ever, yeah.